Good evening. Welcome to session 2 of Unit CHCMHS003, Provide Recovery-Oriented Mental Health Services. Okay, before we start, just want to show recognition for the First Nations people. So in the spirit of reconciliation, Hatt Institute of Education acknowledges the traditional custodians of country throughout Australia and their connection to land, sea, and community. We recognise Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the land on which we work, live, and study. We express our gratitude for the sharing of this land, our sorrow for the personal, spiritual, and cultural costs of that sharing, and hope that we may move forward together in harmony and in the spirit of healing. We pay our respects to all First Nations people and acknowledge elders past, present, and emerging. Okay. All right, so like I mentioned last week, this unit is usually covered over 4 sessions, but because of the time that is divided up into all the units, we can only spend up to 2 units. So I've managed to condense 4 sessions into 2. So session 3 is all about, again, providing recovery-oriented mental health services. As you can see on the screen, there's a few elements that are covered. First one there is about communication techniques. So as we all know, it's the communication techniques are the cornerstone of effective client interactions. Communications in this context goes beyond just exchanging words. It involves things like active listening, empathy, and creating a safe space for your clients to express their thoughts and emotions. So we will look at strategies like using open-ended questions, validating feelings, and demonstrating understanding through body language and tone of voice. The other one is, the next one there is empathetic response and the use of silence. So empathy helps build a connection with clients, allowing them to feel supported and understood. Silence, when used appropriately, can be a powerful tool. It provides clients with a space to reflect on their feelings, process what's being discussed, and even find their own solutions as well. So during tonight's session and during the pre-recordings that I'll play later on, we'll look at examples of how this can be applied in practice. Next is counseling skills, which are essential for fostering meaningful conversations with clients. These skills will enable you to guide clients in identifying the challenges and strengths in taking steps towards achieving their goals. Another key area we will look at is recovery plans and documentation. So developing a recovery plan is a collaborative process that involves identifying the client's goals, strategies, and supports that they require. Finally, we'll look at assessing risk levels. So this is about recognizing when a client is at risk, whether it's due to potential relapse, triggers, or other factors. We'll look at tools and techniques for identifying risks and ensuring that clients receive the appropriate interventions at the right time. Okay, let's go on. Let's do an overview of session 4. So this session builds upon the foundational knowledge we've covered and introduced during the first week and during so session 3 and 4, pretty much. The objectives will be to look at supporting client needs, planning for crisis, diffusing aggression, and engaging in reflective practice. So when it comes to supporting clients' needs and addressing their challenges, every client has unique circumstances, and it's essential to adopt a tailored approach that considers their physical, emotional, and social well-being. Next, we'll look at crisis planning, which is a proactive process designed to help clients navigate periods of heightened distress. Um, we'll talk about some potential triggers, creating actionable crisis plans, and provide clients with the tools they need to regain stability during challenging times. We'll also look at the critical step of diffusing aggression. So mental health professionals often encounter situations where clients may feel overwhelmed or frustrated, which can escalate into aggressive behavior at times. Finally, we'll look at reflective practice. So this is a very important component of professional development. Reflective practice involves in evaluating your interactions, seeking feedback, and continuously improving your approach. It's not just about self-assessment, it's about growing through insights and applying what you've learned to provide better support to the clients that you serve. Hey, all right, so communication techniques. Um, Again, this is the foundation of effective client engagement. On your screen are the four key techniques when it comes to communication techniques. We have active listening, empathy and silence, open-ended questions, and validating your feelings or validating feelings. Active listening involves fully concentrating on what the client is saying rather than just passively hearing them. It includes paying attention to their words, tone, and body language, and then responding in a way that shows that you've understood their message. For example, using affirmations like, I can see how this situation made you feel frustrated, demonstrates that you are engaged and also empathetic. Next is empathy and silence. So empathy is about putting yourself in the client's shoes and showing that you've understood their emotions. Sometimes silence can be just as powerful. So allowing moments of quiet can give the client the space to gather their thoughts, reflect, and express themselves more deeply. Open-ended questions can be valuable tools for encouraging clients to share more about their experience. So instead of just asking yes or no questions, we can ask things like, can you tell me more about what's been challenging for you? So this sort of question will invite detailed responses and help uncover important details about their situation. Finally, validating feelings. This is critical for building trust and rapport. So it involves acknowledging the client's emotions without judgment. So, for instance, saying something like it's completely understandable to feel overwhelmed, given everything you've been through. This will help the client feel seen and supported in the same time. So these techniques work together to create a safe and trusting environment where clients feel comfortable sharing their thoughts and emotions. So as you practice these techniques in real life scenarios, remember that your ability to connect with clients begins with how you communicate. Okay. All right. So here, I want to focus on the power of empathetic response and the strategic use of silence. So let's talk about this a little bit more. In client interaction. So these two techniques are vital for fostering trust, encouraging emotional expression, and managing sensitive conversations more effectively. So with empathetic responses, this involves putting yourself in the client's shoes and genuinely trying to understand the feelings and experiences. So by acknowledging their emotions, you demonstrate that you care and that their feelings are valid. Like the example I used before, a simple statement like, "It sounds like this has been a very difficult time for you," can immediately make a client feel seen and heard. Silence, while it may feel uncomfortable at first, silence is a powerful tool in communication. Um, when used intentionally, it can give clients the time and space that they need to process the thoughts and emotions. This is particularly important during moments of vulnerability or when discussing sensitive topics. Silence shows that you're not rushing them and that you're fully present in the conversation. So together, empathetic responses and silence helps to build trust, foundational element in the therapeutic relationship. So they also allow clients to express emotions as well in their own time and reduce the pressure that can arise in during sensitive topics. So by using these techniques, you can create a safe and supportive environment where clients feel comfortable sharing and exploring their experiences. It's worth to remember or keep in mind that every client is different. So learning to balance these techniques based on the individual's needs is key. Um, so let me ask you guys a question, if I may. Can you think of a situation where silence or empathetic response made a difference in the conversation that you had, and how did it impact that outcome of that discussion?
I think I
Uh,
had a situation, sorry, I don't know how to put my hand up, sorry, where I was talking to a young teen girl and she was struggling to find her words.
mm,
So I found by just sitting quietly, it allowed her to gather her thoughts so that she could speak. So as
mm.
much as I wanted to, I thought just sit quietly. Yeah.
Yeah, excellent. What do you think that did in terms of her emotions and her anxieties at that point, just in staying silent?
Well, it didn't make her feel rushed. It didn't make her feel that she had to justify herself or just it allowed her to go through her process of feelings and actually express herself properly. I
Yeah.
think it just calmed her. Yeah, I think so many of them feel like they're rushed all the time. So,
Hmm.
mm.
Excellent. Yeah, very good. Thank you for that. Tash, were you gonna give an example?
Yeah, it's more of a personal example, but um, when you get delivered bad news, or you have to talk about bad news to somebody,
Yeah.
um, silence can be a key factor in regards to that because it allows them to allows the individual or the group to process what is being said and they can gather their thoughts um, and think of a not a knee-jerk reaction.
Hmm. Yeah, excellent. So silence is very useful, like you said, for clients or people to gather their thoughts. You know, it's like reading a book. When you're silent, you can really understand the content that you're reading because there's no noise around you. But if there's a TV on and there's a conversation happening in the same room and you're trying to read a book, it's going to be really hard for you to get your thoughts together. So during silence, during them sort of situations. It allows people to calm down and just think about what's happening and come up with their reasoning during that period. Priyanka?
Hi, so again, it's a situation which happened with me at my workplace. So while I was working on a project, we were trying to solve a problem, but my colleague, he was trying to find all kind of things which could go wrong. So I was saying anything, and he was saying, "Oh, no, no, that will not work. That will not work." So I became silent, and then I just asked him, I can see you have some concern. So tell me what's your main concern? Because he was not addressing the main thing, but he was just coming up with different things which can go wrong. So the moment I said that, he mentioned that the way we were trying to solve the problem, he had issue with that. So once he said that, I understood the problem and then we worked around it.
Excellent. Very good. Thank you for that. Okay. All right. All right, let's talk a bit more about basic counseling skills now. So these are critical for engaging with clients effectively. So these skills are not just about the theory, they're also practical tools that you should be applying in your day-to-day interactions with clients. So let's break them down into three components that we'll focus on now. So firstly, as you can see on your screen, active listening and validation. So active listening means being fully present and engaged in what the client is saying during the session without distraction or any interruptions. It involves verbal and non-verbal cues like nodding, maintaining eye contact, and paraphrasing what the client has shared to confirm their understanding. Validation, on the other hand, is about acknowledging the client's feelings and their experiences without judgment. For example, saying something like, "I can see how that situation would be overwhelming for you," helps the client feel heard and also valued. The next one there is identifying and addressing concerns. Now, this involves helping clients articulate what is troubling them and working collaboratively to prioritize their concerns. This step is crucial because many clients may struggle to pinpoint their exact challenges or feel overwhelmed by them. So by gently guiding the conversation and asking targeted questions, you can help them gain clarity and a sense of direction. Finally, encouraging personal growth and recovery. So counseling isn't just about addressing the immediate challenge. It's about empowering clients to build resilience, set goals, and take steps towards a healthier and more fulfilling life. This might involve helping them identify their strengths, celebrating small victories, and also exploring coping strategies that can support them during their overall recovery. Okay. Okay. All right. So last week we spoke about a bit about this and also played a video in the beginning. So the Wellness Recovery Action Plan, WRAP. We've got a 4-part series that we shared the link to you guys last week. I think they got about half an hour each. So the WRAP is a structured framework designed to empower individuals in managing their mental health. WRAP is built on values like self-determination, and is tailored to each person's unique needs and goals. And on the screen are the four key components. So the first step would be identifying personal triggers. So these are events, situations, or behaviors that might lead to distress or a decline in mental well-being. Recognizing these triggers early on allows clients to prepare and respond in a more proactive way. The next component is developing coping strategies. Now, these are the tools and techniques clients can use when they encounter their triggers. Coping strategies might include mindfulness exercises, physical activities, journaling, or reaching out to a trusted friend or support worker. The goal here is to have practical methods ready to address challenges as they arise. Monitoring mental health is another crucial element. So clients are encouraged to track their mental health daily and identify patterns or changes in their thoughts, emotions, and behaviors. So this self-monitoring helps them recognize when additional support might be required. Finally, seeking appropriate support is integral to the RAP. This includes building a strong support network of friends, families, counselors, or peer groups, and knowing when and how to access professional help. Encouraging clients to ask for help when needed is a vital part of fostering resilience and long-term recovery. So together, these elements create a comprehensive recovery plan that promotes stability, growth, and self-management. Now, throughout session 1 and today and during the pre-recordings, I'll be discussing as well how to support clients in developing their RAP, ensuring it is both effective and sustainable. So ultimately, the RAP is just it's a documentation and action plan that involves trauma-informed care. So things like empowerment, choice. You guys can help me out if I've just got a brain freeze about the principles. Empowerment, choice, collaboration, having a safe and secure environment for the client, and I think there's another 4 more there. So I've got a question for you guys now. So what role does identifying personal triggers play in preventing relapse, and how can support workers assist clients in developing effective coping strategies? Tash?
So I've actually had to do a RAP plan for myself in the past, and identifying personal triggers is basically writing down everything that triggers you, affects you, and then the way it prevents relapses when you go through the RAP action, obviously the Wellness Recovery Action Plan. Once you've got your coping strategies and your appropriate support and a plan set out, preventing relapses, think of it like a shaken up bottle of soft drink. If you open it up straight away, it's going to pop its top and you're going to relapse. And your mental health is going to be all over the place. But with a wellness recovery action plan, the bottle's been shaken up, you've utilized the coping strategies, and that coping strategy will be putting that bottle down and waiting 10 minutes, then opening it, and it won't be as fizzed up as it would have been if you had opened it straight away.
Yeah. So identifying personal triggers, like you said, will help the client become more aware of their situation or the factors that could negatively impact their mental health. So this awareness enables them to take proactive steps to avoid or manage them triggers. So as support workers, you can assist by discussing potential triggers, suggesting strategies, and practicing these strategies with them to build confidence in their ability to handle challenging situations. Okay. Okay. Assessing risk and identifying relapse. So understanding and managing risk is a fundamental part of supporting clients in their journey to recovery. So here I want to talk about, or I want to discuss the key components of assessing risks and identifying relapse. So this is about recognizing warning signs, seeking help proactively, and implementing the crisis plans. The first step is to recognize warning signs. So these are indicators that the client's mental health may be declining, or that they're at risk of relapse. Warning signs could include changes in their behavior, withdrawal from support networks, difficulty managing daily tasks, or increased emotional distress. Being vigilant about these changes allow for early intervention, which is often the most effective way to prevent any escalation from happening. So once warning signs are identified, the next step is to seek help proactively. This involves encouraging clients to reach out to their support systems, whether it may be friends, family members, counselors, or peer groups. We want them to do this at the first sign of any difficulty. Proactive help seeking empowers clients to take control of their recovery and shows them that they don't have to face challenges by themselves. Finally, implementing crisis plans. So a crisis plan is a set of actions and resources that a client can use during a period of distress. It might include steps like contacting a crisis hotline, attending a support group, or using grounding techniques. Having a crisis plan in place gives the client a sense that they are prepared and can significantly reduce the impact of relapse. So,
What happened? Oh, sorry.
now go
I
ahead,
was just
Maggie.
going to ask. What happens if they don't have any of those things in place and they're clearly unwell? I have a friend who's got a son who's schizophrenic, and he has nothing around him. He has no carers or touch bases or anything. And this boy he's not a boy, but he's disintegrating, for the want of a better word. He's really becoming sort of out of control. So what do you do when you've got none of those things in place, or you can't put those things in place?
Is that because of he doesn't want help, or he just is in because of his geographical situation?
It's because he doesn't believe that he's sick. He
Right.
doesn't believe that he's got any issues. He stopped taking his medication and all that kind of stuff, So, but there's other times when he's quite lucid and he does recognize the fact that there's a problem, but those lucid moments are few and far between,
Yeah.
so
Yeah. Unfortunately, the client or the person suffering from mental health has to seek help first. So they
yeah,
got to buy in and start that journey off, and then from
yeah,
yeah. So that's the biggest problem, isn't it? To getting them to the starting line, and getting them
yeah.
connected with mental health professionals that can help them out with this sort of thing. Is he 18 or?
No, he's 36. So he's not a boy, he's a man. And, you know, he's been like this for a number of years,
Yeah.
probably at least 15 years. So, you know, there's some real issues there. I mean, and that assessing risk and identifying relapse, that's the assessing risk was the part that got me, because that's what it is with him. You know, he needs to be assessed, and he's going out of control, you know. So it's a worry. It's a real worry.
Yeah, yeah. Yeah, there's not much you can do if the client doesn't want any help. Uh,
Yeah,
yeah, unless he's a risk to himself and other people, you can't really get the emergency services involved as well. So
yeah,
it's a tricky subject. Yeah, back in the days in the 70s, in the 60s, they just would have taken him to hospital straight away without even asking him. Which is not ideal anymore. That's not what we want. Um, but you know, some people go through the cracks because they believe they don't need any help, and you know, it's just a personal choice, and we just got to wait for them to realize that they do need mental health intervention, and yeah, there's nothing we can do, Maggie.
yeah,
Fortunately.
yeah. Unfortunately, yeah.
Yeah.
I was hoping it has something. I'm always trying to help him, that's for sure.
Yeah. Awesome.
I think that was one of our questions in something, and it was to when someone wasn't ready to admit or wasn't ready to seek help, by at least putting things in front of them and letting them know they weren't alone, they're not the only one, and all that sort of stuff, was sort of opening the door to, you know, and sort of, you know, like maybe leave a few pamphlets around, for lack of other things, you know, to sort of say
Yeah,
it can happen and they've got to pick it up, don't they, Kane?
yeah,
Yeah.
yeah,
That's a good idea,
yeah.
actually.
It's
Yeah.
really, yeah, yeah. That is a good idea. But it's
Yeah.
quite sad to see a human being in this state. You know, it's really sad. And he's a lovely person. You
Mm,
know, so but he's disintegrating, for the want of a better word. You know, you can see that, you can hear it, you can see it in the way he holds himself. He's drinking more alcohol now. You know,
mm,
he's getting a bit out of control in that sense, becoming a little bit more aggressive. You know,
yeah.
so yeah. But yeah, I'll speak to his mum again and see what we can do, because I really fear for her, actually. Although I don't know whether he would hurt her, but you never know. You never know. You know.
Yeah.
So we'll see.
Um,
Anyway,
I did want to say, Maggie, there is an option. If you can reach out to the local mental health service line, and if you could get him admitted, like on the possibility, get him temporarily admitted under the Mental Health Act, they may be able to administer the depot injection for schizophrenia, which is a medication that helps with it, and you get an injection once a month. So then that takes away the need to take tablets all the time. It's just one injection every month.
yeah, he's been on depot before, and now just absolutely refuses to take it. I didn't like it. I don't like the
Okay.
fact I've got to take an injection every month, that kind of stuff. And when he was on the depot, he was not bad at all. He certainly didn't have the breakouts like he's doing now. So,
So he's
but
obviously tried it already, and
yeah, yeah, and it worked. It worked for him quite well. But he said it makes him feel like he's outside of himself. So,
Yeah.
yeah.
anyway,
All right.
so be it.
Okay. All right. Now let's talk about responding promptly and positively when faced with challenging situations involving clients. So these techniques are designed to hopefully de-escalate tension, build trust in the same time, and ensure everyone's safe. So the first and most crucial step, I believe, is to stay calm and supportive. So when the clients are distressed, your calm demeanor can help create a sense of stability and reassurance. Remaining composed allows you to think clearly and respond effectively to the situation, setting the tone for constructive interactions. Second is it's important to avoid challenging or insulting the client. Priyanka?
You're on mute.
Thanks, Maggie. So, I have a question. What if the patient is suffering from bipolar disorder and they are having a manic episode where they have just become hyper and they are just talking aggressively? And even if you become calm, it's not having any effect on them. So, how do we deal with that kind of situation?
So yeah, that's the more extreme side of things. If they are having a manic episode, depending on the setting, it depends on the setting, depends you what. If it's a mental health facility in the community and a client has that during the session, I would clear the room. I would remove myself from the room to give him some time to manage his that situation at that time, because not much you can do when he's at that heightened level. If you know the client well, if you've dealt with him before and you understand what he does during them times to settle down, you can provide that assistance to him. Just remind him, oh, why don't you go for a walk outside, or you like watching television when when you got these episodes, and or why don't you get that book out and start reading until you feel a bit better. Um, but yeah, generally it's about keeping yourself safe during that time as well. Yeah.
And what if this situation happens in a public place? You don't know the client and you just notice someone who's going through it. So, do we intervene and do something about it? Or,
Um, if it's in a public place and he's having a manic episode, he might be having that episode because you don't know why he's having it. He might be having it because he feels anxiety over of all the people around him, or something must have triggered him. So you got to be very careful when you approach the individual. I would, if I saw someone struggling out in the community who was having a manic episode, I would approach him or her, but I would do it. I wouldn't like sneak up from behind. I would make sure when I'm walking towards them that they can clearly see that I'm walking towards them, and I wouldn't get too close.
okay.
And yeah, just your body language needs to be positive as well. So then your hands open down to the ground, and keep an eye contact, making sure you look empathetic, and just trying to ask questions to find out what the problem is. Yeah.
Okay.
No,
Thank you.
all good. So I think we're up to avoiding challenging or insulting the client. So I said, I was saying that challenging their perspectives or using confrontational language can escalate the situation, leading to further frustration or aggression. So when clients are at that state where they are angry and they are insulting you, it's human nature that you want to give that energy back to them. You don't want to, you don't, you don't want them to get away with it. But in a professional setting or in any setting, it's important to treat people the way you like to be treated, even if they are treating you like shit and they're talking down on you and they're swearing and insulting. As the professional, it's important that you keep high level professionalism at all times. And the way to do that is to keep in mind that, or to always treat your clients like a mirror. Now, what I mean by that is when you look in the mirror and if you do funny faces and you look angry and look aggressive, you're going to get that reflection back. But if you're calm and you're collected and you're smiling and you're showing empathy, usually 9 times out of 10, that client's going to feel that energy and his level of anxieties and aggression is going to start dropping slowly. And it's going to start coming back to normal or come back to the norm. But if you respond with aggression and insults, that behavior is just going to keep escalating, and then you're going to lose a client. So we've got to focus on validating their emotions and finding common ground during them situations. So, for example, saying something like, "I understand why you might feel like this," may help diffuse tension and show some empathy as well. Finally, know when to seek family or professional help. So sometimes the situation may require additional support, whether it involves a trusted family member, consulting with a colleague, or escalating the matter to a mental health professional. So recognizing when you need to help ensures that the client receives the best possible care possible that will help protect both the client and yourself. So by combining these strategies, we're able to create a safe and supportive environment that allows for positive outcomes, even in challenging circumstances. Okay, adjusting the recovery plans. So recovery is not a linear process. Plans often need to be adjusted to ensure they remain effective and also relevant. So the key steps involved in adjusting recovery plans are on the screen there: reviewing progress, identifying new goals, and implementing additional support services. The first step there, reviewing progress. So this involves regularly evaluating how well a plan is going, which will help you identify what is working well and what might need to be changed. So this could involve talking to the client and finding out their experiences, reflecting on the challenges that they faced during this time, and assess whether the strategies that are in place are helping achieve their goals. Next, identifying new goals. So during this time, the client's progress, what they need and what they aspire to do may change. So, for example, a client who initially focused on working on their anxiety might later aim to do something like rebuilding relationships or return to work. So, by setting new goals, we ensure that the process of recovery evolves alongside the client's journey. So it's not a static plan. It's always evolving. We've got to be flexible to help our clients reach their or meet new goals. Finally, implementing additional support services, so such as therapy groups, vets, so vocational training, or community activities. Collaborating with our clients to find the right support will help us to find or design the plan that the plan remains comprehensive and also tailored to their needs. So the question there is, why is it important to regularly review and update recovery plans, and how can this practice improve outcomes for our clients?
Things change.
Yeah.
Different things that you've got in place. It could change. The client could be going in a different direction from when you did your first plan. So, you have to look at it, I would say, regularly to adjust it if necessary.
Yeah.
They might be getting better. They might be getting worse. Yeah, you just have to go with the flow.
Exactly, yeah. So the client's needs change, and sometimes they reach them goals, So doing the same thing over and over and over, even though you met that goal, can be could affect their motivation in rehabilitation as well. So we've got to quickly we always got to review and update the progress. So we're on top of their progress, so we know where they're at during their journey, and we also got to continually have open communication with the client to make sure they still feel motivated towards their goals and action plan. And if they don't, and then it's our role to help them to make the required changes, obviously in collaboration with the client as well. All right. Aileen?
Hi. Yeah. In terms of adjusting recovery, I know that most of the patients who suffered from mental issues are having a recovery back and forth. So
Yeah.
means I think we also have to consider that sometimes they already set the plans that this one, but we thought it's a continuous recovery, but in somehow it will be disrupted with something, so we have to go back again or give some another options of recovery
Excellent.
plans.
Yeah, so we need backup plans, contingencies in case of relapse as well. And one is, so if a client feels they're about to relapse or, something's about to happen, we've got to have them support networks available. So that's one good area to have, or for them to go back to their support networks. But yeah, that was an excellent point. We're going to have contingency plans in case of relapse. Okay. So I want to talk about the importance of connecting clients with programs, services, and support systems that enhances their recovery journey. So these resources provide additional tools and networks to address the various aspects of mental health and well-being. So as you can see on your screen, there's a few up there now. So hospital services. So these facilities, as we know, provide critical care for clients experiencing severe mental health episodes. So they offer specialized treatment, including medication management, crisis intervention, and access to mental health. So hospital services are usually the last resort when it comes to mental health situations. Next is peer support groups. So these groups allow clients to connect with other people who face similar challenges, creating a sense of community and also shared understanding. Finally, complementary therapies. So these involve mindfulness, meditation, and exercise, to name a few. These therapies address physical and emotional well-being, helping clients to manage things like stress, improve mood, and also building resilience. So the question there, what else? Sorry. Which of these resources do you think would be most impactful for a client experiencing social isolation, and how could you encourage them to engage with these services?
Hi.
I would go with, firstly, the peer support groups. I find that, because people have similar issues, they're quite happy to help others, so I'd probably try the peer support groups.
Yeah, I was thinking the same thing, Maggie. Yeah, Priyanka?
Sorry, I'm just thinking because the person is already experiencing social isolation. So if we put that person in a peer support group where he or she will be surrounded with a group of people, it might become overwhelming for them. So maybe complementary therapies like mindfulness, yoga, deep breathing where they are just interacting with one person at one time might open up. Yes, it's all right to interact with people. Once they become comfortable, then maybe we put the person in peer support group.
Yeah, it's either or, depends on the client. So your client and so when it comes to psychologists, that use CBT therapy, so cognitive behavior therapy.
Yeah.
They might say to the client, for your recovery, I'm going to expose you to these things that you're uncomfortable with. So it could be going into peer groups. So that for the client to recover, the psychologist might say, okay, we need you to be exposed to your fears. So then you start getting comfortable in them situations. But you're right. Also, depending on their situation and their current state of mind, mindfulness techniques and other therapies might be beneficial to start with before you take the big step into getting into social settings. So yeah, either or, it just depends on the client. So with peer support groups, can be particularly impactful for clients experiencing social isolations, as you can imagine. So these groups provide a safe space for clients to connect with others who understand their struggles, fostering a sense of belonging and support. So it's important that we encourage the client to attend by discussing the potential benefits and offering to accompany them if need be, if they do feel that they are struggling during the first session. But like you said, Priyanka, if they are not ready for that stage, obviously there's other things we can do as well. Aileen?
Yeah, I just want to ask, I'm just wondering, until when is the support of psychiatrists and psychologists in terms of assisting the clients?
Sorry, Aileen, can you just repeat that?
I mean, I'm just wondering, until when is the support given by the psychiatrist or psychologist with the patients if they are already in the recovery period or having some programs and services from outside?
So are you saying when is the best time to ask for assistance?
No, to end the assistance from the psychologist or
Ah.
psychiatrist when they are already in this program services, or it's
Oh,
throughout their journey.
It really depends on the client. If the client feels that they are ready, that they don't require the assistance anymore, and the psychologist is happy with their progress, I guess they can end it. I know a lot of clients. I know personally people who've gone through mental health issues for years, and who to me look like they've recovered, but they continue to see their psychologist probably on a monthly basis as well, because I don't think inside of them they feel ready, that they are actually recovered, and also I think it's a sense of reassurance as well.
Yeah, I
But
just
yeah, but another thing worth mentioning, a lot of psychologists will cut the service as well. So because especially with clients who have suffered depression and anxiety, with anxiety and OCD, the problem with that mental illness is reassurance. So the psychologist might stop the service after they feel like they've taught them enough, because the client will the client will start using the psychologist as a form of reassurance. So in that way, their OCD and anxiety is now using something else to reassure their fears. So some psychologists might even stop the service, saying, this is not helping you anymore. We've already done all our sessions. By you coming to me, you're only seeking reassurance. So a form of therapy would be avoidance as well. Yeah, it's very tricky with mental.
But I think the one thing that you mentioned that is important is when the client is already well equipped for the things that someone really needs to learn.
Mm.
And I think that's the thing that sometimes they, cut the connections. Yeah.
Yeah.
Mm.
Daniel?
Yeah, hey mate.
Right.
I've already done this unit before, so I know it's a little bit off topic, but I only joined because I just wanted to ask a quick question because I've done my Cert 4 with the previous company. Am I able to go ahead with different units because I can't really get access to them, or do I have to wait until you get to them?
No, you can contact
You-
SLO
Yep.
and just let them know that you want to open further units and just explain why.
Oh, beautiful. All
Yeah.
right, thank you, mate. Appreciate it.
No worries.
Bye.
Okay. Never had that
That was
one.
just weird.
Let's go on to a case study before we have a break.
Oh God.
Oh. All right. So Alex, 25 years old, has been grappling with severe anxiety that begins intensifying after they were unexpectedly laid off from their job 6 months ago before losing his job. Why are they using there?
Sometimes the
pronoun.
English is terrible.
Yeah, I think it's because of the pronoun thing.
Yeah, that's what I was about to say. Could be what
Yeah,
they identify as.
yeah. All right. So before losing their job, Alex was a high-performing individual in a competitive industry, deriving a strong sense of identity and self-worth from their work. The sudden job loss has deeply shaken their connection, leaving them with persistent self-doubt and feeling of inadequacy. Since the layoff, Alex has become increasingly isolated. They avoid social interactions, fearing judgment or criticism about their situation. Invitations from friends are often declined, and they rarely leave their apartment except for essential errands. Their once active social life has diminished, and their support network has started to grow distant, compounding their feelings of loneliness and hopelessness. Financial stresses is another significant factor contributing to Alex's anxiety, with savings dwindling and no stable income. Emotionally, Alex finds him finds themselves stuck in a cycle of negative self-talk, often blaming themselves for the current situation. They describe feelings of being overwhelmed by the simplest of tasks, and so on. Despite these challenges, Alex has expressed desire to regain control over their life. They shared that they want to rebuild their self-esteem, reconnect with friends, and eventually find meaningful employment. Alex is openly exploring strategies and support systems, but feels unsure about where to begin. So, what communication techniques can we use to support Alex, and how can the RAP plan, be
I
developed to
think they've
help
used
Alex?
there in the wrong place in a number of issues, a number of places.
Sorry, Maggie. Sorry, Maggie. Oh, can you guys hear me? Yeah. No.
Yeah, I can hear.
Okay. So the last question is, how can REP plan be developed to help Alex manage anxieties? All right, so I'll give you guys 10 minutes to discuss this as a group, and then we'll come back, and then we might discuss it together, and then we'll have a little break. All right, I'll see you guys in 10 minutes.
Okay, so the RAP plan identifies what are his triggers. I'm just rereading. Fearing judgment and criticism about the situation, avoids social interactions. Please, anyone jump in. So it's not just me.
I think he's definitely got he's getting depression, like early signs of depression, which are escalating quite quickly. So he's already also saying he's admitting he needs help. So that's the first step. I think rebuilding his networks, and rebuilding his confidence. There's a lot there to have to try and pick apart.
Yeah. So I was just looking for the RAP plan, like the RAP plan information. So he's stuck in a cycle of negative self-talk, often blaming himself, doesn't feeling overwhelmed. These and like the layoff, the financial stress, these are all triggers. And in the RAP plan, basically, once you identify the triggers, then we have to then identify strategies. So what can we do to alleviate the financial stress? And a way that might be is by getting him to see a financial counselor
Yeah.
or contacting my budget or interlinking with a communal counsellor that might be able to help branch him out into other areas that can help with his financial stresses. So that's just one strategy, a couple of strategies for that one particular trigger. Then you've got the layoff of his job that like you can easily you can walk him through by like searching for new jobs. That can be a strategy.
Yeah, I agree with you, Tash. I think we have to identify the issues and give some suggestions in resolutions to to his problems. I think he's just
Exactly.
concentrated on having the big chunk of the problem and not realizing that there's something that it can make it easier, like like the financial issues. Is he's having
Like
a hard
bite-sized
time.
pieces.
Yeah, so if he's having a hard time paying for his bills, so he just contact the like example the mortgage, that example for the mortgage, call up the bank. Maybe they have some program like some financial hardship. Yeah, and
Exactly.
then yeah, so at least it will be things will be much more clearer, and the fear will be lesser. Yeah, in a
Yep.
way, it will reduce the anxiety and the depressions, and he will be coming up into solutions slowly. And in terms of his job, so it's a connections of pointing where are, I mean, the possible people that can help the who's this, Alex? Yeah, to have some
Yeah,
connections. Yeah, thank you.
I agree.
Do we also think as well, like something I looked at before was how you focus on the positive? You know, what are the things that you do have that are working for you? What are the things that, you know, can we reach out to your friends and your family? You know, that positive reinforcement to try and have a starting block of something that's makes them feel a little bit more empowered.
Well, I don't know if it's intentional or not, but everything that in this case study is all negative. So maybe you are right. Like maybe we need to start flipping it and seeing it from a positive perspective. Like a layoff, he might be, yes, he's increasing his isolation, avoiding social interaction, and all of that. But the positive side of that may be that he might need time to readjust his life. readjust
Do
what's
some
important
study
to
like
you.
we are.
Yeah,
Yeah,
we're
like,
learning.
like readjust and learn, and it might give him a bit of time to pause and reevaluate life. So the layoff might be stressful and the catalyst, but the positive side of that may be that it might not have been the right job for him. He might have just been doing it for the financial reasons. Like, you know, me and my partner call it the survival job or the survival car or the, you know, the survival house. It's not your dream goal, it's not your dream car, it's not your dream house or job, but it pays the bills.
Yeah.
And that's what Alex could have been doing.
Yeah. I
Yeah,
think
it's very easy to get stuck in the same rut, isn't it? So
Yeah.
it can be, that's what I'm saying, turn it around. I mean, there are some negatives, of course, but turning it around to sort of say, what can we do with this? You're now free to study or look at a different option. What are your passions? What do you want to do? You know, yeah, sorry, Aline.
I know. I just want to acknowledge Tash. I think she is in really a right path. I think a lot of people will benefit with her knowledge. Yeah.
Thanks.
Yeah. So I think it's a really a good one. So we can go to number 2. Oh yeah, I think it's part of the discussions that we had. The wrap.
What communication techniques can you use to support Alex? Well, open-ended questions. That would be my go-to, paraphrasing. Also being positive, like Tanya was explaining.
So it's also
You
saying
know,
down the bottom, it says, despite these challenges, he's expressed a desire to gain control over his life, rebuild self-esteem, friends, you know, get meaningful employment. So it's a base, it's a grounding block, you know, and you ask him, so what does that look like for you? What, you know,
that's what I was saying. 'Cause it
Yeah.
says here, eventually find a meaningful employment. That's what I meant about a survival job. He's probably just doing it to pay the bills. He's not invested in it. He doesn't like it. So he's now just like, F it. You know, I'm not doing this no more. And now it's given him time to actually assess what he wants to do what we're doing, and, you know, upskill, relearn, change a career. But yeah, also, like you were saying, like, you know, ask him open-ended questions like, where do you see yourself in 5 years? Or 2 years or 3 years, like, you know, stuff like that, you know, because he might have big dreams that he's never told anyone because he's too scared to say something in case that dream doesn't come true, and then he sees himself as a failure.
So it's rebuilding confidence as well, isn't it? Because it says, you know, since the layoff, he's lost confidence and become isolated. So it's sort of opening his mind up to new ideas and yeah, going back into what he's enjoyed and what he'd like to do. That's good. Yeah, we can help him.
Yeah, we can do it. Collaboratively, we can do it.
Sorry, guys, I'm like in and out today.
It's all good.
I've got like a sick puppy.
Oh.
Yeah.
All right, guys. We'll take a break now. We'll come back in 10 minutes and we'll go through the assessments. All right, so I'll see you guys at 7:26. See you guys.
And before you leave, which assessment are we going to look into?
Probably past 2.
Cool. Thank you.
Okay. See you guys then.
See you then.
Okay. We're up to the assessments. I think we covered assessment 1 last week. So we'll look at assessment 2, which is the case studies. All right, so this comes in 3 case studies and just a few questions that you got to answer. So it's not that time consuming, I don't think. So I'll just read the first one. So case study 1, Pam. So Pam is 35 years old, a 35-year-old woman recovering from postnatal depression after the birth of her first baby 6 months ago. She tells her social worker, "I'm going to start practicing saying no more often." Her social worker, Vicky, replies, "That's very assertive of you. Are you prepared for the reactions?" Everyone is used to me saying yes all the time. My mother, my husband, and my friends. They'll be surprised when I say no to some of their demands, but they'll have to get used to it. If I keep trying to make everyone happy, I will go mad, says Pam. Vicky says, "I'm proud of you for making the decision to look after your own needs. Let me know how you go when we meet again next week." Vicky then makes progress notes in Pam's file. During the next meeting, she asks Pam about her progress and they discuss ways to improve upon and extend Pam's empowerment. So, the item 1 there is name 2 characteristics of a holistic and person-centered approach. So 2 characteristics and 2 person-centered approach. Can you guys think of any characteristics?
Being supportive.
Yes. Yep. So individualized support.
Yeah.
B1, yeah. So this tailors care and interventions to the unique needs, strengths and circumstances of the individual, which will ensure that they receive personalized and meaningful support.
Sorry,
Yep.
sorry, Kian. So what are we supposed to do here? Are we just supposed to say the name of the characteristic, or we have to define it as well? Like from holistic point of view,
Yeah.
we are interested in emotional well-being of Pam because she's suffering from postnatal depression.
Yeah.
So shall I just write emotional well-being, or do I have to define it as well? What exactly I mean?
It doesn't ask you to explain it, so just the characteristic will do, I think.
Okay.
Yeah, I think so. Yeah, it doesn't say explain your answer there. So I think just individualized support or empowerment and active participation, something like that will suffice. What about person-centered approach?
So isn't empowerment person-centered approach?
Yep, it can be. Yeah, it can be both. There's also respect for autonomy and strength-based focus as well for the approach, person-centered approach. Can anyone think of any other ones? Okay, let's move on to the next one then. Provide an example of a best practice framework that assists in the planning process of developing a wellness recovery action plan. For example, referring to the mental health practice standards or utilizing a goal setting framework like SMART goals. Type your answer here.
I don't understand that question.
Okay, so our best practice framework that supports the planning process of a wellness recovery plan is the SMART goal framework. You can use a SMART goal framework. So the SMART framework ensures that the goals set within the RAP process are structured and achievable. So they make sure it's specific, so clearly defining the goal. So measurable, so establishing how progress will be tracked. If it's achievable, so ensuring the goal is realistic and within the individual capacity. For example, I will start with a small request before asserting myself in bigger decisions. Relevant, align the goal with person's values and long-term well-being. For example, setting boundaries with will help me manage stress and avoid burnout. And time, so setting a timeline for reassessment. For example, I'll reflect on my progress in a week and adjust as needed. So this framework around SMART, the SMART framework supports things like empowerment, self-awareness, and recovery-oriented practices, which will ensure that the individual, in this case, Pam, remains engaged in the personal wellness journey. Okay.
So do we have to use the SMART goal? Like, do we lay it out like we do with SMART? And you put you put the first column in and you basically put the second column in. Do we have to lay it out like that, or do we just write it out?
Just write it, yeah. Just write it, that's fine. You can use other frameworks, but I think SMART is the easiest one to follow.
Yeah.
With this question, yeah, I wouldn't I wouldn't create a table or anything like that. Just explain a little bit about why SMART is would be an effective framework, and just go through
Yep.
each one. Yeah.
Yeah. Okay. Cool.
Yeah. Okay. Identify 3 things you need to consider when developing a collaborative planning meeting with your client. What do you think? What do we have to consider when we develop a collaborative planning meeting? Tash?
The location.
Yeah.
For example, say the client is in a hectic environment or a DV relationship and they're needing help and assistance,
Mhm.
having the collaborative planning meeting at their house would not be appropriate.
Mm.
So you would bring the client into a safer environment.
Mm. Excellent. Very good. Anyone else?
Would you also have to consider their state of mind, like where they're at, whether they're suffering from anxiety or what have you, so you have to concern yourself with their state of mind, how
Yeah,
they're going
perfect.
to,
Yeah.
yeah,
Yeah, client readiness and engagement. Yeah, definitely.
yeah,
Yeah, that would definitely be one. Things like goal alignment and personalization. So what I mean by this is that we need to focus on the client's needs and strengths and aspirations, ensuring that the planning process is person-centered.
yeah,
And another thing that we need to consider is ongoing support and follow-up as well, amongst
yeah.
other things, yeah. All right, let's go to case study 2, Thomas. Thomas answers the door and barely grunts a greeting to Jenny, his mental health support worker. Jenny keeps her own greeting quiet and low-key as she knows that Thomas takes a while to warm up and feel comfortable communicating. As they head to the kitchen to sit down, Jenny makes a few small comments about the weather, glancing at Thomas to check his body language. After asking Jenny if she'd like a cuppa, Thomas looks more comfortable as he goes about making tea for them both. From previous meetings, Jenny knows that Thomas finds it easier to communicate while he's busy, so he doesn't have to engage in too much eye contact. To facilitate easy communication for Thomas, Jenny asks if they can take their tea outside and if Thomas can show her the garden. Jenny uses Thomas's obvious enthusiasm for the garden as a way to establish rapport and to make him feel more comfortable. She uses this as a starting point to discuss the planning session. Sounds like a very smart support worker.
I agree.
Yeah. All right. So what are the 3 reasons why it is important to use good communication skills in planning meetings with people with mental health needs?
Probably because they're all individual and not everyone's going to fit the same mold. So what works for some person might not work for the next person. And I know personally, say for an example, like not mental health related, but if I go for a job interview, the first thing I say to the employer is I struggle with eye contact. I'm sorry. It's not a reflection of me. It's just I struggle with eye contact. And that could be also implemented with mental health as well. Like if you know your client struggles with like Thomas, he struggles with eye contact, you can engage with him in another way that doesn't involve face-to-face staring.
Yeah.
That's what it sort of feels like.
Yeah, excellent. All right. Anyone else, guys?
So can we say that it's important to use good communication skills? First of all, to understand the needs of the client. Secondly, to build a trust with them.
Yeah, so building trust and rapport would be one of the reasons why. So establishing a safe and supportive environment will help this individual to feel more comfortable, which is important for effective collaboration and engagement. Definitely. So one reason would be building trust and rapport. Can anyone think of any other reasons why it is important to use good communication skills in planning meetings with people with mental health needs?
You've got structure.
Yeah.
They respond to a structure.
Excellent. Yeah. So structure it helps with ensuring clarity and understanding as well. So clear communication reduces things like, and structure reduces misunderstandings, ensuring that the individual can express their needs, preferences, and goals more effectively. Another one is a reason why we do all this or use good communication skills is to encourage active participation. So using good communication skills will empower the individual to take an active role in their own care plan, leading to a more person-centered and effective support strategies. Okay. Name 3 effective communication skills with which you should be familiar.
Are we talking about skills like active listening?
Yeah. So active listening will be one.
What about staying quiet?
Yeah.
Including body
Silence.
language and
Yeah.
hearing.
Yeah. Like we spoke about before, silence is
What
a form.
about compassion?
Sorry, what was that?
Empathy.
Compassion and
Yeah.
empathy.
Compassion, empathy, validation. Yeah. They're very good there.
Non-judgmental.
Yeah. Not using non-judgmental. Not being judgmental towards the client. Yeah, being careful of what you say. Non-verbal communication awareness as well, very important. So being mindful of your body language, tone of voice, and that will fall under not being judgmental as well. And also your facial expressions to ensure communication is reassuring. Aileen?
Suddenly flight. I think it's another thing is becoming sensitive, especially be mindful on the triggers.
Yeah, yeah, definitely. All right, I think, yeah, let's go to the next one. What are 3 common cultural requirements that you may need to discuss with consumers or your clients?
Well, you need to know what their culture is. They might be Australian, they might be First Nation, they might be Italian. So you'd need to find out exactly what their culture is before you can make any further assumptions.
Yeah, definitely.
What about their language? Oh,
Mm.
and I am okay. What about their language and their comprehension of English? So you're making sure that, as it's their second language, that they can actually understand how you are, and if get them an interpreter or someone of their own nationality if necessary.
Perfect. Yeah.
Yeah.
Aileen?
Sorry, I think from the previous one, I make it clear.
Okay, that's all right. Tash?
I think also with the cultural side of things, it can be closely linked into their religious beliefs. So, say you got to be really mindful in someone might be um, first generation or second generation Australian, but they might have Muslim beliefs or they might have Buddhist beliefs. You can't assume what beliefs they have,
Mm.
and you have to be very mindful because, especially like with halal meat and stuff, like
Mm.
you don't want to tread on anyone's religious toes, if that makes sense.
Yeah, excellent. Yeah. So recognizing and respecting cultural or religious practices.
That's the word I was looking for.
Excellent. All right. Priyanka?
I was just thinking, like in some cultures, females they prefer to talk to a female, and male prefer to talk to male. So maybe we can find out if they would prefer same gender or it can be any gender.
Yeah, perfect. Yep. Very common, I want to say problem, a very common request from clients. Excellent. All right, let's go on to case study 3. Fiona. So Fiona has experienced clinical depression for most of her adult life. She has sought assistance from her general practitioner, psychiatrist, and Beyond Blue organization. She is committed to achieving recovery from her depression. Fiona explains, "For me, recovery is deeply personal, unique process of changing my attitudes, values, feelings, goals, and skills. I want my life to be satisfying and hopeful, and I want to make a contribution to society. Recovery involves the development of new meaning and purpose in my life beyond my mental health needs." Very insightful. Okay. What are the 3 common cultural requirements that you may need to?
That's the same question.
Yeah, it is, isn't it? Very similar.
Yeah, that's the same question.
Do we just copy and paste?
No, sorry. Yeah, it is the same question, isn't it? What
It
are the
is the
3?
same.
That has happened before in previous assessments.
Perfect. You don't have to just copy and paste. Excellent. All
There'll be somebody out there that won't like that though.
Yeah, I know.
There'll
One
be
of
a
the
remarker.
assessors will be like, "Oh, nope."
Yeah,
All
it's the
right.
same question.
Yeah.
I don't understand like what this question has to do with Fiona's case study.
Cultural requirements.
Because it doesn't talk about anything in culture in her case study.
No.
Yeah, you're
No, that's why it's not relevant.
Yeah. So what the theme I'm getting amongst these questions is like even with these ones, they don't really relate the questions are not really specific to the case study,
No.
which is a unique way of doing an assessment. But I think it's much easier for you guys. So I would just go with
Okay, I'm
it.
happy with that.
So you're saying don't relay it to every case study, each of these people. It's a
These,
general
yeah,
thing.
these ones are not asking specifically about the case study. So there's,
Okay.
yeah. So it's just saying name 2 ways to strengthen. Have you guys gone into your assessments yet for this unit?
Yeah,
And
I
are,
have.
No,
are these the questions, Tanya?
Yes.
Yeah. All right. Good.
Yeah.
All right. Just in case I'm showing the wrong questions. So name 2 ways to strengthen a person. So they're not specifically asking about the case study, but that's fine. We'll just go with it. So yeah, let's name 2 ways to strengthen a person's self-efficacy.
Allow them to have a
positive.
voice. Sorry.
That's
Yeah,
right.
all right. Maggie?
Oh, I was just going to say positivity, explaining to them that, they're doing well in their counselling, they're making inroads into their plan that they've made.
Yeah. Excellent. So with this, that's correct. So when you're answering this question, I wouldn't just leave it at 1 or 2 words. I would explain a little bit more. So like Maggie said, encouragement with things with like small achievements would be one. So helping the individual set and achieve realistic goals to build confidence in the ability to make positive changes could be a way of explaining one example. Can anyone think of any other ones? Ways that we can strengthen a person's self-efficacy.
What about reflection, reflecting on the positive moves they've made to even get to this point that they're at now, sort of thing?
Yeah, so so celebrating the successes, highlighting the achievements, providing positive reinforcement and support would be an excellent example. Yeah. Aileen?
Yeah, I think it's also giving some praise if you're learning from your clients also, because I mean, every day we learn from someone, and even though they are our clients, we are getting some learnings from their thoughts. Yeah,
Yeah, of
that
course.
we need to recognize. Yeah.
Yeah. Excellent point. Yeah. So recognizing their lived experience, a lot of good mental health professionals are people who have lived experience with mental health, as well. So yeah, so the best people to help others are usually people who have gone through the same struggles. Tash?
Yeah, I was just about to say that. Also, like Tanya had mentioned, positive reinforcement is like a really strong thing.
Mm,
Like I find with strengthening someone's inner self, if you constantly work like say their negative things, they're not going to feel good about themselves. But if you use positive reinforcement, they're going to be more willing to be engaged. They're going to be more willing to be susceptible to taking on knowledge and learning and implementing strategies and ideas that you have for them.
mm, yeah, that's right. Yeah. All right. Anyone else? All right, let's move on to the last one. What are 2 questions that you can ask to confirm people's choices for personal wellness, development of self-efficacy, cultural requirements, values, meanings, and purpose in life? So what are 2 questions that you can ask to confirm people's choices for personal wellness, development of self-efficacy, cultural requirements,
So
value? Yeah,
In terms of wellness, we can ask them, what does wellness mean for them and how do they want to achieve it?
excellent. Yeah, you could, yeah, or you can go further and excellent question. Yep, I'll be happy with that as an assessor marking. But you can also go further with that if you wanted to and say, do you understand what wellness is and the and what it is divided into? So you get an understanding that of their understanding of what wellness is. When people think wellness, that don't understand what it is or well-being, they just think it's about their physical health. They don't understand it's all about, social, mental, emotional, spiritual as well. That could be one, but excellent question there. Yeah. Anyone else?
What about their goals as well? Like where do you see yourself at, moving forward? What would you like in your life? What would you like to achieve? Where do if you could build like a vision board or something like that, where do
Excellent.
you want to be? All positive. Yeah.
Perfect. Yeah. So what meaningful activities or goals would you like to focus on, and that will give you a sense of purpose and for fulfillment as well? Perfect question. Tash?
I don't know how to put it into a question,
Mhm.
but my point would be something on the lines of how to make or how to approach a holistic and person-centered approach for that client. I don't know how to I don't know how to put that into a question, but that's, yeah, like I would have like that's the goal and point that I want to make, but I don't know how to rephrase that into a question.
I think good question, but I would ask that question more for like more people who are more advanced into their journey, because asking something about holistically, you're talking about the bigger picture. So you're talking about incorporating all these things into one goal. But what we
Okay.
want to do is break them goals down into more simpler, more achievable goals. So when we directing or setting up our questions, we want to align our questions with the possible goals that they might set. So I
Okay.
wouldn't ask overly complicated questions. It is a good question, but in terms of
Just simplify it.
yeah, we need to make things simple for our clients, so we're not scaring them. We're not,
We're not intimidating them with
that's
knowledge.
right. Yeah. Perfect. Yeah, that's right. Aileen?
How about the approach of sharing something that, like, oh, have you listened about this? Are you familiar with this podcast, or are you familiar with this book? I think this one is relating to your case that maybe you can interested in. So
Yes. So if you're in a session with a client and to build rapport and some sort of some sort of rapport with the client, you would bring up things like podcasts or their interests in that. But I wouldn't use that sort of example for this assessment.
mhm.
But in a real life scenario, definitely, yeah, you would find things that interest them and get them motivated, and then you would use them as part of your questioning. Definitely.
Okay. Yeah. Thank you.
Tash?
Sorry, I just did have one quick thought. It sort of breaches onto the assessment one, but we touched on boundaries. You know how you said that a good support worker is usually someone that has lived experience in mental health. Where do you draw the line between sharing too much of your personal stuff to build a rapport?
Hmm. Good question. It just depends on, I don't know. It's very hard to answer that. Like with me, I've suffered yeah, mental health in the past as well. And when I work in juvenile justice, as you guys know, in one of the correctional facilities, and sometimes when I work with clients who are struggling or young people who are struggling, I do, and I can relate to them. I would bring up my past experiences, like with things like OCD or anxiety and that sort of stuff. I would bring it up
Yeah.
in a general term, but talking about specifically what kind of thoughts and intrusive thoughts that I had, I wouldn't get into that sort of stuff.
Oh, okay, so that's where you would draw the line.
I would
So
draw the
keep
line.
it as a general thing,
Yeah,
but keep the personal side of it to
yeah.
yourself.
Yeah,
Otherwise,
I wouldn't
otherwise
divulge.
he will likely shit himself if he heard what was going through my mind.
I don't think they need to know. I don't think that it's a subject that they need to
No.
have access to.
Yeah,
They
and you got to
don't
be
need to.
careful with, especially with young people, with things like
They're
OCD.
very impressionable.
Yeah, your triggers and your thoughts can manifest into them as well if you talk about it. So you got to be very careful. You don't want to cause any more triggers or any more harm to your clients. So yes, talking about your lived experience is effective, but you got to be very strategic in the way you use that experience. Okay.
Sorry, I just thought I'd ask.
No, well, good question. That was good. Aileen?
Yeah. How about reassessing with the patients wherein you will be asking if is he taking anything or he needs anything, some support, or you want I mean if I can offer some help to middle in between to achieve the goal, like for example uh, doing something in the gym, or maybe he wants some recommendations or something before doing it. Yeah, some offer of help
Yeah,
in able to achieve the dream.
excellent. Yeah, very good. You guys are all on top of this. Very good. I think Mark, is Mark here? He had his hand up for a sec.
Yeah, I was just going to how much should I was going to help you out with the question, how much should I give when dealing with people and telling them your own story? But
Yeah.
I think you covered it quite well. Yeah, I think that it's just that if you need to go into a little bit more, or
Sorry,
you
we're
feel it,
losing you,
you
Mark.
feel it.
Mark, your connection just
Sorry?
keeps dropping off. Yeah. Your connection just keeps dropping off.
I think he's frozen now.
Hmm. Mark works in the industry as well, so I think he works in Resi Care, so he would have good insight.
Yeah, he's a really good resource. But just so everyone's aware, they think that I'm some, miracle worker. Mark is better than me.
Yeah, and if you ever need motivation or support with role plays, you go to Mark. I think he's pretty
Yeah,
much so.
he's
Poor
really
guy's
good with role
frozen.
plays.
The poor guy's frozen. He can't justify himself. Hey, Mark.
Hi.
We're just praising you, Mark. It's all good.
He's gone now, is he?
I can.
Yeah, I think so.
All right, that's all right. He's pretty much done anyway, so
You'll see it in the recording anyway.
yeah, I think he's got 1 unit to go.
Wow.
So he's done. He's done really well. All right.
Fantastic.
So we've answered all the questions, guys. I don't think there's any role plays for this, so yes, no
Yay.
role plays.
So is each of these things like a couple of sentences or at the most a paragraph?
I wouldn't do a paragraph. I think 2 sentences will suffice for each, especially for this question here.
Okay.
This question is just 1 sentence each, so just a question that you would ask. Yeah, but this one here, the item 8, name 2 ways to strengthen a person's self-advocacy. I would explain this a little bit more. So I wouldn't just write something like encouraging small achievements. I would expand on that. Okay.
I think that
Because there's
covers
one
all
marker
the
there that is really tough. If you don't write enough words, he sends it back.
What's his name?
He's unbelievable. I'd have to have a look on one of my assessments, but
Is it
I've had him
Arvin?
send me my work back. Pardon?
Arvin?
Yes, that's it.
Yeah.
Arvin, yeah.
Yeah. He's a good
He's
marker. Yeah, but
he's tough.
he gives feedback. He gives good feedback as well. He provides
Yeah.
feedback. Yeah. You don't agree, Matt?
No, I don't.
I don't either. I'm sorry. I'm going to agree
No.
with Marty on this.
Yeah, he's got a
Yeah,
hard job,
he's
though,
he's
because he's one of our
yeah.
main markers, and he's doing about 90 assessments a day. So
Wow.
yeah,
So,
he's got.
Cam, do you
Oh.
know which days he works so that we don't submit assessments on those days?
Yeah.
No, Priyanka,
I don't
what
think
we
that
do
makes
is
whoever gets it first.
we
Yeah.
just send Kyan an email as soon as you've submitted your assessment and get him to do it.
Yeah.
Sorry, another question. But we have some preceptor saying that you have your preceptor or something when we are receiving some email. Are they our preceptor or actually no?
The presenter, you mean?
This preceptor, wait, yeah, I mean I forgot the name of the, yeah, I mean the person to contact to,
For
That
this.
was
yeah, to submit all your assignments or something, or
Ah,
no, anyone. Is it anyone
so
or?
Anyone picks it up.
Okay.
yeah.
Not a specific person then, because I saw from my,
No.
No,
okay.
Yeah.
I just keep getting Arvin.
Okay.
He's become my
maybe as a
personal
soft
marker.
spot for you.
Yeah, I'll start
Could be.
tomorrow. I will start tomorrow, so let's see.
All right, guys, we'll have a 5-minute break, and then on the other side, I'm going to play the pre-recording for this session. I'm just going to warn you, it goes for about an hour. So, yeah, if you want to call it a night, you can watch it tomorrow, as the recordings will be sent to you guys. And if you want to use this time for assessments and other things, completely up to you. You don't have to stay and watch the pre-recording. But I cover the wellness plan and all that sort of stuff in a more more thoroughly in that recorded session. All right, so I'll see you guys in 5 minutes. If not, I'll see you guys next week.
Okay.
So will you be annotating the slides?
Yes, so it's a pre-recording that I will play where I speak back to the slides. Yeah.
Okay, cool.
All
All
right.
right.
All good.
Cam, sorry, before you leave, I have a question for you.
Yeah.
Do you, is it possible to get access to the slides as well along with your recording?
Yeah. So you can I'm pretty sure you can get the PowerPoint
Off
presentation
the
on your portal.
yeah,
Okay.
learner portal.
Because what I noticed, like last year when I opened up the PowerPoint slides, the content was different from what was used in the classroom. So I don't know if
Yeah. So
they have been updated.
No, so during my live sessions, so the presentation that I do, that's my presentation that I do during the day. I do a summary of what the key learnings are,
Okay.
and then that's separate to what Hader does. And the pre-recording that I do is the slides that you'll see in your resources.
Oh, okay. Wonderful.
Yeah. All right. I'll be back in 5 minutes, guys, and I'll play that recording.
All right.
Okay.
Question:
Yep.
Are you gonna cover the SMART program in this recording?
Did it last couple of nights ago. Did I cover it? Not sure. Tash, I'm not going to lie to you.
Okay.
I think I may have, but you'll have to watch and see.
Yeah, all right, well, thank you.
All good. All right. Okay, now let's just go over the overview of this session. So, as you can see, the first two core units, the two core areas that we'll be covering today is the wellness plan and collaboration. So both of these elements are foundational to providing recovery-oriented mental health services, and they're deeply interconnected in practice. So let's break them down quickly. So when it comes to the wellness plan, it's important that we, as professionals, will focus on this area. These are structured, personalized plans that provide a roadmap for recovery. They help individuals set meaningful goals, identify their strengths, and address any barriers that might arise along the way. So during today's session, and we did touch on this last week, we'll be looking at what goes into a wellness plan, including identifying an individual's unique needs, goals, and their aspirations. Strategies to encourage individuals to take an active role in developing and managing their plans. We'll be looking at the practical steps for implementing these plans in a real life scenario, ensuring they're flexible and responsive to changes. We'll look at how these plans are not just documents, but dynamic tools that empower individuals to take control of their journey towards recovery. A well-designed wellness plan helps individuals stay on track while also fostering their independence, resilience, and hope. Next, we'll look into the topic of collaboration. So providing recovery-oriented mental health services is not something that can or should be done in isolation. Collaboration is about creating strong, respectful partnerships with everyone involved in the recovery process. This includes the individuals themselves, of course, their families, caregivers, and other professionals such as doctors, counselors, and community support workers. We'll also discuss how to work collaboratively with individuals to ensure their voice is central to the process. We'll look at the value of building partnerships with families and support networks to strengthen the recovery framework. We'll also look at the importance of interprofessional teamwork to deliver holistic and effective services. Collaboration also means recognizing and respecting the diverse cultural, social, and personal context of the people we work with. By the end of today's session, I hope that you'll have a better understanding, or you'll be better equipped to bring together different perspectives, strengths, and resources to create truly integrated approaches to recovery. Communication. So communication plays a crucial role in supporting individuals throughout their recovery journey. There are two key techniques that I want to mention. The first one is active listening and normalizing statements. So these techniques are essential tools for building trust, fostering understanding, and ensuring that the individual we work with feel heard and respected. Let's start with active listening. So this technique goes beyond simply hearing someone's words. It's about fully engaging in what they're saying. Active listening involves maintaining eye contact to show you're present, using verbal cues, like I understand or tell me more, to encourage them to continue sharing. Reflecting on what they've said by paraphrasing or summarizing key points to confirm understanding. When you practice active listening, you demonstrate that you value the individual's thoughts and their feelings, which is especially important in recovery-oriented environments. It also helps you better understand the individual's experience, their needs, and their goals, allowing you to provide more effective support. The second technique is on the screen is normalizing statements. So these are statements that help individuals feel less isolated or ashamed about their feelings or experiences. For example, if someone shares their feeling of being anxious, you might say, that's completely natural to feel this way, given what you're going through. Or if someone is struggling to open up, you could reassure them with something like, many people find it difficult to talk about this at the first time you have your session. So by using normalizing statements, you validate their experiences and reduce feelings of stigma or self-doubt. It helps create safe space where they feel more comfortable sharing and exploring their thoughts and emotions. Both active listening and normalized statements are foundational to effective communication, especially in recovery-oriented practice. They build rapport and trust between you and the client. They encourage open and honest dialogue. They also create an environment where individuals feel supported, understood, and empowered to take steps towards their goals. Now, as we move forward, we'll look deeper into each technique and practice applying them through some examples and role play activities or case study activities during our live sessions. So take a moment to reflect on how you've used these techniques in the past in your own interactions. Think about what's worked well and what could you improve on. And we might talk about that during our live sessions. Okay, so like all presentations, there are certain videos or certain links to videos that we cannot play during our recorded sessions. But as always, these links will be sent to you guys in an email for you guys to watch in your own time. Again, we highly recommend that you do watch these videos, as it will give further knowledge and understanding of the unit. Okay, so to continue on with communication techniques, effective communication is the cornerstone of supporting recovery-oriented mental health services. Now, here I want to go through two more techniques that can enhance our interactions with individuals: reframing and oars. So these techniques help us foster positive, productive, and meaningful conversations, especially challenging situations. So let's start with reframing. Reframing is about shifting the way someone views a situation, challenge, or experience. It's not about denying the perspective, but offering a different way of interpreting it. So one that is more empowering or solution focused. For example, if the individual says that I failed at everything, you could reframe this by saying you faced a lot of challenges, but each one has helped you learn and grow. Let's look at what you've achieved along the way. Or if someone shares, I'll never be able to manage this, you might say, as a reframing technique, that this feels overwhelming right now, but you've shown resilience in the past. Let's break it into smaller, more manageable steps together. Reframing is a powerful tool because it helps individuals see possibilities rather than the barriers, instilling a sense of hope and motivation to move forward. So next we have OARS, which stands for open-ended questions. The A stands for affirmations. The R stands for reflective listening, and S is summary statements. So OARS is a core technique used in motivational interviewing, a collaboration style of communication designed to strengthen an individual's motivation and for change. So let's start with open-ended questions. So these encourage individuals to share more about their thoughts and feelings. Affirmations, this is about recognizing and reinforcing the individual's strengths or efforts. For example, you could say something like, it's great that you've been open about your feelings, and sharing takes courage. The next one is reflective listening, and this is about paraphrasing or summarizing what the individual has shared to ensure understanding. And summary statements. So this is when we are wrapping up the conversation by highlighting key points and next steps. This technique fosters trust and collaboration, which will allow individuals to feel supported and understood as they work towards their goals. Both reframing and oars are essential tools for navigating conversations that can be emotionally charged or challenging. They shift conversations from negative to possibility. They also encourage individuals to feel seen, heard, and valued. And they also help build a collaboration environment that is focused on growth and recovery. Okay. All right, let's keep going with communication techniques. So effective communication involves more than just words. It requires us to be fully present and engage with the person we are supporting. Now, the three key techniques on the screen are vital for meaningful and supportive interactions: attending behavior, paraphrasing, and encouraging. We spoke a little bit about paraphrasing as part of oars, but we'll go for a little bit more in this slide as well. So attentive behavior, let's start with attentive behavior. So this is all about being physically and mentally present when engaging with someone. So it involves using verbal and non-verbal cues to show the individual that you are fully focused on them and what they are sharing. Some of the key aspects of attending behavior is eye contact, body language, and minimal verbal encourages. So this is about using brief phrases like "I see," "Go on." Paraphrasing. So paraphrasing is a technique used to ensure mutual understanding and demonstrate that you have heard the individual clearly. It involves restating what the person has shared in your own words, focusing on the core message. Another example of reframing is if someone says, "I feel like I'm always struggling and getting nowhere," you might paraphrase that by saying, "It sounds like you're feeling stuck and frustrated with your progress." Now, paraphrasing has several purposes. It shows that you are actively listening and you are making an effort. It allows the individuals to clarify or expand on their thoughts. And it also helps to reinforce trust and rapport by showing genuine interest in their experience. The last one there on the screen is encouraging. Encouraging involves using positive reinforcement to motivate and uplift the individual. This could be as simple as acknowledging their efforts or pointing out their strengths. For example, "It's great that you're sharing this. It takes a lot of courage." Or, "You've shown incredible resilience by continuing to work through these challenges." Encouragement helps individuals feel valued and supported, which can boost their confidence and willingness to engage in the recovery process. It's about highlighting progress, no matter how small, and reminding them that they are not alone. Okay, let's have a look at basic counseling skills in a practical setting. So this slide introduces the concept of role plays as a learning tool where we practice these essential skills in a safe and supportive environment. Role plays are an excellent way to observe, reflect, and refine our techniques. They are important because they allow us to practice in a safe environment. So it gives us the opportunity to try out different approaches without the pressure of real life situation. It allows us to gain insights by stepping into different roles. Then we can better understand the perspectives of both the counselor and the individual seeking support. It allows us to build confidence as well, receive constructive feedback as well after role plays. In the upcoming role play sessions that you'll have, or the information session, you'll have opportunity to ask questions about the basic techniques that are required when applying role plays for your assessments. But these role plays that we do during our assessment, it's not just about passing assessments or completing an assessment to pass the unit. It's about learning key techniques to better enhance yourself, to better apply yourself as a counselor or a professional in working in mental health, in the mental health field. You learn to refine your skills in terms of active listening, paraphrasing, summarizing, and encouraging statements. So it's very important when you are doing these role plays, you use it for that reason to improve your ability in client interactions. Okay, developing and documenting plans. Developing and documenting plans is very important aspect of recovery-oriented mental health services. This process allows us to create a clear and structured path for individuals tailored to their unique needs, goals, and circumstances. On this slide, we'll focus on 3 critical elements: personal wellness, recovery and implementation, monitoring and review. Let's explore these components in a more detailed way. So let's start with personal wellness. So this is a foundation of any recovery plan. It encompasses the individual's physical, emotional, social, mental well-being. When developing a plan, we need to focus on identifying the individual's strengths and resources, the challenges or barriers they are currently facing, goals that support a balanced and fulfilling life. Recovery. So recovery is not just about addressing symptoms, but it's about empowering individuals to lead meaningful lives despite their challenges. A recovery plan highlights the individual's aspirations and what they consider important for their personal growth. It also highlights steps to overcome specific obstacles, such as addressing trauma, managing symptoms, or finding employment. It helps you with identifying tools and resources that foster independence and resilience. So in this stage, we aim to help the individuals move from surviving to thriving by focusing on their long-term vision for recovery. Finally, a well-documented plan is only effective if it's actively implemented, regularly monitored, and periodically reviewed in a more thorough manner. So this ensures the plan remains relevant and responsive to the individual's evolving needs. Some key steps include implementation. So this is about breaking down goals into actionable steps. Monitoring, so keeping track of progress. Review, so revisiting the plan to make adjustments based on the individual's progress, feedback, or any changing circumstance. Developing and documenting plans ensure that services are person-centered, collaborative, and structured. So providing clear and measurable pathway for recovery is very important. By doing this, we'll have the opportunity to practice and create plans to incorporate these elements. Okay, as we continue exploring the process of developing and documenting plans, we'll continue to focus on specifically and widely recognized frameworks such as the Wellness Recovery Action Plan, which we covered last week. And I did speak about this last week, where there are 4 video links, a four-part interview, 4-part series with that involves the RAP. So I encourage you guys to watch that as well. The Wellness Recovery Action Plan RAP is a personalized approach to wellness and recovery that empowers individuals to take control of their journey. Let's talk a little bit more about this, about RAP as is and how we'll explore over today's session and also the live session. So RAP, or the Wellness Recovery Plan, Action Plan, sorry, is a structured evidence-based tool designed to help individuals identify personal triggers and stresses, 2, develop practical strategies to manage challenges. And 3, create a comprehensive plan for maintaining wellness and recovery. What makes RAP unique is it focuses on individual strengths, goals, and preferences. It is entirely person-centered, meaning the individual is in the driver's seat, supported by their network of care. So during these 2 weeks where we've been covering this unit, you will see that we've been taking a step-by-step approach to understanding and implementing RAP. So last week and this week, we were looking at different sections of RAP for our framework. This included learning about the foundational components of RAP, exploring real-world examples of how RAP can be tailored to diverse needs and circumstances, hearing from participants by watching the videos, them links that were provided to you guys. So as we've been working and learning about RAP, you'll see the focus is on wellness tools, daily maintenance plans, crisis planning, post-crisis planning. RAP is more than just a plan. It's a mindset. It fosters empowerment, self-determination, and hope. It's trauma-informed. So by focusing on what works for each person, RAP helps individuals build resilience, enhance their self-awareness, and takes control of their wellness journey. It's a practical tool that aligns perfectly with the principles of recovery-oriented practice. This is the episode 3 of the RAP series. Managing risk is an essential component of recovery-oriented mental health practice. Risk plans are tools designed to help individuals and their support networks identify and address potential challenges that could disrupt their wellness or recovery journey. Now, here it outlines 4 key aspects of creating effective risk plans: assessing risks, identifying triggers, marking relapse, and seeking help. So assessing risk is the first step in creating a risk plan. It involves identifying potential challenges or situations that could lead to harm or setbacks in an individual's recovery. Open communication to identify any concerns or fears they may have, collaboration with other professionals and support networks to gather more insight. The next one is identifying triggers. So triggers are specific situations, events, or experiences that may lead to emotional distress or risky behavior. Identifying these triggers is critical to helping individuals maintain stability. So some common examples could be conflicts in relationships, financial stresses, exposure to certain environments or substances. Once triggers are identified, we can then work with individuals to develop the strategies for managing or avoiding these triggers. The next one is marking relapse. So relapse or relapses, whether emotional or behavioral, can be a normal part of the recovery process. Marking or recognizing relapse is not about assigning blame, but about understanding patterns and learning from setbacks. And now these involve documenting what led to the relapse, reflecting on the individual's response and its outcomes, identifying steps to move forward and regain stability. By normalizing relapse as opportunities for growth, we empower individuals to view challenges as part of their journey rather than as a failure. The last part there is seeking help. So a strong risk plan emphasizes the importance of seeking help when needed. And they include things like creating a clear list of people or services that they can contact, ensuring they have access to the crisis lines, phone numbers, mental health professionals, practicing when and how to ask for help, encouraging individuals to seek help proactively rather than reactively can make a significant difference in how they navigate challenges. Okay, level of risk. So when working with individuals on their recovery journey, assessing the level of risk is an essential part of this process. Now here I want to introduce 3 key aspects to consider when evaluating and managing risk: potential risks, potential benefits, and how risk can be reduced. By addressing these components, we can create a balanced, proactive approach that supports individuals' goals while ensuring safety and wellness or well-being. First, we need to identify and assess potential risks. So this could include emotional or physical harm, situations that might lead to setbacks in recovery, challenges in maintaining stability. So when evaluating risks, it's important to take a collaborative approach by involving the individual and, where appropriate, their support network. It's equally important to consider the potential benefits of any action or decision. So recovery is often about taking calculated risks to achieve personal growth and independence. For example, a new job might bring financial stability and a sense of accomplishment, but could also introduce stress. So by evaluating both risks and benefits side by side, we can help individuals make informed decisions that align with their goals and values. Encouraging individuals to weigh the potential positives can instill hope and motivation. Finally, the focus shifts to strategies for reducing risk while maximizing benefits. This involves creating clear, actionable plans that include developing coping mechanisms and resilience building techniques, identifying supportive resources such as trusted friends and family, and also professionals, preparing contingency plans for managing setbacks or unexpected challenges. For example, if someone is considering taking on a new role that may be stressful, strategies could include setting boundaries, participating in mindfulness or practicing mindfulness, or scheduling regular check-ins with their support networks. Balancing risk and benefits helps individuals build confidence while maintaining a safety net to support them through their journey. It also fosters empowerment by involving them in decision-making processes and reinforcing their ability to navigate challenges. When working with individuals on recovery-oriented plans, identifying clear timeliness is an essential part of the process. Timeliness provides structure and focus. It helps individuals visualize their progress and stay motivated. On your screen, you can see 4 key elements to consider when setting timelines: clear actions, steps, empowerment, and timetables. So let's break these down further. So the first section there is clear. So timelines need to be clear and specific. There's no room for any guessing games, as these can then lead to confusion or inaction. It's important to outline objectives in a way that is easily understood. Next is action steps. So breaking goals into manageable actionable steps is very important. Large goals can feel overwhelming, so smaller, more actionable steps make them more achievable. For example, a long-term goal like securing a stable job can be broken down into steps such as creating a resume, apply for 3 jobs per week, and so on. And then we have empowerment. So timelines are not just about structure, they're also about empowerment. So by setting achievable goals and timelines, individuals gain a sense of control over their recovery journey. Finally, a well-structured timetable will help keep everything on track. So timetables provide a visual representation of the timeline, showing when each action should occur. Okay, so session 3 and 4 is covered during this week. So we're up to session 4, so the last part of this session. So here we'll be looking at 3 main areas, which is facilitating support, support responses, and reviewing effectiveness. So facilitating support involves creating opportunities for individuals to access the help that they require from a variety of sources that include professional services, informed networks, and community resources. The next one is supporting responses. This focuses on how we as professionals respond to the unique needs and circumstances of the individuals that we work with. And then we'll look at the importance of reviewing effectiveness, regular evaluating the impact of support strategies, ensure things like goals are being met on time, progress is being made, any barriers or setbacks are identified and addressed promptly. So together, these three areas, facilitating support, responding effectively, and reviewing outcomes, create a comprehensive approach to recovery-oriented care. They emphasize collaboration, adaptability, and continuous improvement. Supporting and meeting the needs of individuals in recovery requires a thoughtful and comprehensive approach. Now, here it outlines three essential elements to consider when designing and delivering support: holistic care, aging capacity, and level of involvement. Now, when it comes to holistic, meeting needs holistically means considering the individual as a whole rather than focusing solely on one aspect of their life. This involves addressing the physical needs, emotional, mental well-being, social connections, cultural or spiritual dimensions as well. Then we have age and capacity. So support must also be tailored to an individual's age and capacity. It should involve understanding developmental stages, recognizing individuals' capacity for self-determination, offering age-appropriate tools and language. For instance, a young person might need simple explanation and more direct guidance, whereas a teenager or adult may prefer to take more active role in decision-making. The level of involvement refers to how engagement or how engaged an individual is in the recovery process and the decisions affecting their lives. To meet needs effectively, we need to encourage active participation, balance professional input with individual preferences, adapt our level of involvement based on their readiness and comfort. This will empower individuals and reinforce their autonomy, which is key to building resilience and self-efficacy. Okay. Okay, so the first challenge involves in addressing barriers that may hinder an individual's progress. These barriers could include things like practical obstacles, such as lack of transportation, emotional or psychological barriers like fear, systematic issues such as difficulty navigating services. Overcoming these challenges require engaging open, empathetic conversations to uncover hidden barriers, collaborating with individuals to develop creative and practical solutions. Supporting individuals during a crisis situation is another critical challenge. So crisis can take many forms, including emotional distress or mental health episodes, external events like loss, trauma or sudden life changes, behavioral challenges such as self-harm or substance use. To navigate these situations, it's essential to stay calm and composed, providing a sense of stability, use crisis intervention strategies such as de-escalation. And also adhering to procedures can sometimes feel like a challenge, especially when balancing organizational requirements with individual care. So procedures might include documentation of interactions, plans and progress, compliance with legal and ethical standards such as confidentiality and mandatory reporting. These challenges, addressing barriers, responding to crisis, and adhering to procedures, are an inherent part of our work. However, they also provide opportunities for growth, learning, and collaboration. By approaching these challenges with empathy, creativity, and also professionalism, we can turn obstacles into stepping stones for success. Okay, again, wrap. So I won't cover this part. we've covered enough during the first part of this session, also last week's session. This is episode 4, so the last episode of RAP. It goes for about roughly 20 to 30 minutes each episode. Preventing recurring challenges is a vital part of supporting individuals on their recovery journey. This slide highlights 4 key approaches to addressing this. The first one is immediate needs. So the first step in preventing recurring challenges is addressing an individual's immediate need. These might include things like ensuring safety and stability, providing emotional support, connecting individuals with urgent resources like healthcare. Meeting immediate needs create foundation for recovery and reduce the likelihood of setbacks. Recovery is not a straight path, and plans need to evolve as circumstances change. So review and adjusting plan ensures that it remains relevant and effective. These will involve things like reflecting on the work, gathering feedback from individuals, updating goals and strategies. The next one is identifying success. So recognizing and celebrating success is crucial for maintaining motivation and confidence. Success doesn't have to be large or dramatic. It can be as simple as attending a therapy session, reaching out to support groups for the first time, or managing stress in a healthier way than before. Lastly, developing a positive view of challenges can transform setbacks into opportunities for growth. So this mindset shifts involves viewing challenges as a normal part of recovery, encouraging reflection on what can be learned, supporting individuals in developing problem-solving skills. By framing challenges as learning experiences, we foster resilience and reduce feelings of defeat when difficulties arise. Responding to individuals in a timely, positive, and supportive manner is a critical aspect to building trust and fostering effective recovery-oriented care. This slide highlights 4 key aspects that guide our response: the boundaries, referral procedures, legal responsibilities, and ethical responsibilities. Now, establishing and maintaining professional boundaries is essential to ensure safe and effective support. They help create clear distinctions between personal and professional roles, build trust by providing consistency, protect both the individual and the professional. Sometimes the best way to support an individual is by connecting them with additional resources and expertise, so referral procedures. These involve recognizing when individuals' needs exceed your role expertise, providing accurate and timely information, assisting the individual in accessing these services. As professionals, we have specific legal responsibilities that guide our work, and these include ensuring confidentiality while adhering to mandatory reporting, maintaining accurate documentation of interactions, acting within the scope of our role. In addition to legal obligations, ethical responsibilities play a significant role in guiding our responses as well. These will involve acting with honesty and integrity, avoiding conflict of interest, advocating for individuals' best interest. Ethical responses ensure that our actions align with the values of dignity, fairness, and empowerment. Responding to individuals in a supportive and timely manner is critical to building trust and ensure effective outcomes. Here I want to outline 4 key principles that guide our approach: remaining positive, being non-judgmental, staying objective, and focusing on the solution. Now, a positive mindset is a foundational point to providing effective support. Remaining positive doesn't mean ignoring challenges. Rather, it's about offering encouragement, highlighting strengths and progress, maintaining hope and belief in the individual's capacity, positively fostering trust, motivation, and resilience. Being non-judgmental is essential for creating safe and supportive spaces. This involves listening without preconceived notion, validating the individual's feelings and experience, avoiding language or behaviors that may unintentionally shame or blame. A non-judgmental approach ensures that individuals feel respected and understood. Remaining objective means approaching situations with fairness and in a neutral way. This can be challenging in emotional charged scenarios, but it is important to focus on the facts, separate personal feelings or opinions, provide balanced feedback and support. Objectivity helps ensures that our responses are thoughtful, effective, and aligned with individual goals. Lastly, a solution-focused approach emphasizes actions and progresses, and these will involve collaboration, breaking down large challenges into measurable goals, exploring resources and strategies that align with their needs. By focusing on solutions, we help individuals move from feeling stuck to taking more meaningful steps forward. Managing aggressive situations can be challenging as well, but with the right approach, it is possible to diffuse tension and prevent escalation. I want to outline 3 key strategies to handle aggression effectively: remaining calm, avoiding insults or challenges, and calling for help if needed. So the first and most critical step is diffusing aggression, is to remain calm. Your demeanor sets the tone for interaction, and staying composed helps. Things like reducing tension, communicating that you are in control of the situation, providing a sense of stability. Some practical techniques to remain calm would include breathing deeply, taking deep breaths, speaking in a steady or measured tone, maintaining relaxed body language to avoid appearing confrontational. Engaging in confrontational behavior can escalate aggression, so it is important to avoid using languages or tones that could be perceived as dismissive. Refrain from arguing or criticizing or challenging. Instead, focus on validating their feelings and redirecting the energy towards finding a solution. Sometimes managing aggression requires additional support. So if the individual is not responding to your efforts to diffuse the situation, it may be necessary to involve a trusted family member or friend or another worker. Ensure that the person remains calm and neutral. If the situation becomes unsafe, escalate to appropriate professionals or emergency services. Okay, I'm just going to end it here. There's only a few minutes and the recording will stop. But you can catch the rest of it in the link that will be sent out to you guys later on, guys.
Yep, that'd be great.
All good. Okay, have a good night.
Thank you. See ya.